So thyroid function test we will discuss as you have discussed yesterday. Today again we'll discuss. There is a different test is performed to know the function of thyroid gland, and that is listed as a thyroid function test. So you can see here there is a different test to measure the to measure the level of TSH, T3 and T4, and there is many more to know the function of the thyroid glands. Okay, so first you can see here the test that assess the status of hypothalamic pituitary thyroid axis. If you want to know or assess the hypothalamic pituitary thyroid axis, you can measure the level of TSH. So if you measure the level of TSH, what you can find out hypothyroidism or it is a hyperthyroidism. So based on the level of TSH, we can categorize this status of thyroid into the two groups, that is hypothyroidisms and the hyperthyroidisms. So if there is increase in the level of TSH, it is known as the hypothyroidisms, and the decrease in the level of TSH, and that condition is named as a hyperthyroidisms. So this is only on the basis of TSH. Later we will see T3 and then T4. But in the basis of the TSH, you can say if the level is high, TSH level is high, it is a hypothyroidism, and TSH level is low, it is a hyperthyroidism. So in the case of hyperthyroidism, the level of TSH will be decreased. Similarly, in the hypothyroidism, the level of TSH will be increased. And this will give you the idea to know about the hypothalamic and pituitary and thyroid axis. Second test you can perform to measure the T3 or the T4 in the serums. Basically, in the last class we have discussed why to measure the free T3 and the T4. Okay, rather than the total T3 and the T4, it's better to measure the free T3 or the free T4 because it depends on the binding proteins like tyrosine binding globulins determines the level of free T3 and the total T3 and the total T4. If there is increase or decrease in the thyroxine binding globulins, which bind around 70% of the thyroid hormones, so that determines or that influence the level of total T3 and the T4. So it's better to measure the free T3 and T4, which is not influenced by the thyroxine binding globulins. So here you can see if you measure the free T3 and the T4, in the case of hypothyroidisms, the level of T3 and T4 will be decreased. Similarly, in the case of hyperthyroidisms, the level of T3 and T4 will be high. So if you will combine these two, like TSH and the level of T3 and T4, so in the case of hypothyroidism, the level of T3, T4 will be decreased, but TSH will be higher. Okay, if you will take these three together, TSH, free T3 and free T4. In the case of hypothyroidisms, the level of thyroid hormones, that T3 and T4 will be lower, but TSH will be high. Similarly, in the case of hypothyroidisms, we will get the just opposite results than the hypothyroidisms. TSH, free T3 and T4 level will be higher in the hypothyroidisms, and the TSH level will be decreased. TSH level will be decreased in the case of hyperthyroidisms. Okay. The third one you can see here, the test that assess the metabolic impact of the thyroid hormones on the peripheral tissue. So there is a different other test which is not directly related. Okay, but you can do some test that assess the metabolic impact of thyroid hormone on peripheral tissues. So you can measure the BMR, that is basal metabolic rate, and that will give the idea about the percentage. Like the value in the thyroid patients normally range from 15% to plus 5%. In the severely hypothyroidisms, you can see in the minus 40%. In the increased thyroid conditions like the thyrotoxic patients, it will have the more than 25% to 50%. So in this way, by measuring the BMR, you can know the metabolic thyroid hormones impact on the metabolic conditions on the peripheral tissue. Similarly, we can measure the measurement of the biochemical biomarkers that alters the thyroid status. So there is a different other things you can measure, other molecules you can measure as a biomarkers. Like you can say in the case of thyrotoxicosis, increased level of ANP you can have, alkaline phosphatase will be higher. Similarly, in the thyrotoxicosis, there is a decrease in the low density lipoprotein cholesterol or LDL cholesterol you can say. In the case of hypothyroidism, you can measure the CKMM, LDL, which level will be also measured. We can found there is increase in the LDL cholesterol, and the vasopressin will be decreased in the case of hypothyroidism. These are just you can supportive biomarkers, which is either increase or decrease in the case of increase or decrease thyroid functions. Okay, like in the hyperthyroidisms or hypothyroidisms. So these are supporting markers you can measure. The fourth one, the test for the presence of thyroid antibodies. So during the thyroid disorders, there is a production of some antibodies. Okay, in the different disease condition, you can find out this one. Okay, so what are the antibodies which can be produced against the some molecules which is related to the thyroid glands? Okay, so TSH, so antibody which is produced against the TSH that you can measure. Even the antibody which is produced against the thyroglobulins you can measure, and similarly we can see the antibodies which is produced against the enzymes that is known as thyroid peroxidase enzymes. So against that also there is autoantibody can be produced in the some conditions, so you can measure that one. Okay, antibodies can be measured. So out of these three, in the laboratory generally they are preferred to measure the NTTPO, that is the antibody against the thyroid peroxidase enzyme. Okay, that is generally said as the NTTPO. Okay, in the market it will be saying in the lab NTTPO. Okay, so that is antibody, autoantibody which is produced against the thyroid peroxidase enzyme. So you can measure these antibodies if you have any doubt of the autoimmune diseases which is related with these thyroid disorders. The fifth one, the test that assess the thyroid iodine metabolisms and the biosynthesis. So what you can do here, you can give the iodine which is labeled with the radioactive. So radioactive iodine will be given to the patients, and you can measure in the 24 hours. Okay, either it is utilized or not, we can see here in this graph. Okay, in the case of hypothyroidism, it level will be decreased. In the normally, it will be, you can say the second one, that is a normal. In the case of hypothyroidism, it will increase. Okay, the utilization will be increased in the case of hyperthyroidism. In the case of hypothyroidism, utilization will be decreased. So on the basis of like iodine uptake is done by thyroid gland or not, so you can give the radioactive iodine and you can measure in the 24 hours, and you can see it is utilized or not. If the gland is hyperactive, it will be utilized, and if it is hypo, the iodine will be not utilized by the thyroid gland. You can also measure the thyroglobulins. So increase in the patient with the both benign and malignant thyroid carcinoma. So you can measure the thyroglobulins also, which you find increase in the benign or malignant thyroid carcinoma. So this is all regarding the uh, thyroid function test. But out of all this, in the routine practice in the laboratory, they are doing very few. They will be performing the serum free T3, free T4, TSH, and if it is required, then they will do the anti-TPO. Okay, anti-TPO. So this four parameters is generally performed to know the status of thyroid glands and thyroid hormones, you can say. This four, free T3, T4, and TSH, and if it is required, then anti-TPO. So this four is routinely performed in the laboratory to know the status of thyroid hormones. Okay, anti-TPO if they are suspecting the autoimmune diseases which is related with these thyroid disorders, so they'll go for the detection of the autoantibodies, that is the anti-TPO. Okay, rather than this radioactive iodine uptake, thyroglobulins, they'll be performing the mainly these four. Okay, free T3, free T4, TSS, and anti-TPO. So, any doubt in this thyroid function test? Are you getting? Are you following me? Anyone? Can you respond?
Yes, sir.
Okay. So now we'll move to the another topic, that is the thyroid disorders. Uh, Already I have said there is a main two thyroid disorder, that is a hyperthyroidism and the hypothyroidism. So we'll discuss what do you mean by hyperthyroidism and the hypothyroidism, and easily you can find out by knowing the sign and symptoms of the thyroid disorders. So from that, if you are facing all that symptoms, you can say you are having the thyroid disorders. Okay, so we'll discuss how to know these thyroid disorders. So on the basis of these three parameters, that is the TSH, FT3 and FT4, and you can find out this either it is a hyperthyroidism or hypothyroidism. So first you can see the hypothyroidism. So in that case the TSH will be higher, but this thyroid hormones, that is a T3 and T4 level, will be low. Similarly, in the case of hypothyroidism, just look at the just opposite. You will get just opposite results. TSH will be low and the T3 and T4 will be high in the case of hypothyroidism. So you can say if the thyroid gland is hyperactive, it will produce the T3 and T4, and that time by the feedback regulations, the level of TSH will be low. Okay, but in the case of hypothyroidism, uh, defects in the thyroid glands or damage to the thyroid glands, so it will not able to produce the T3 and T4. To increase, our body try to increase the level of T3 and T4, so the level of TSH will be high due to the response, like our body will say there is a decrease in the level of T3 and T4 or thyroid hormone. So to it try to compensate it, so level of TSH will be high. So what is the causes of hypothyroidism? So we'll discuss one by one, hyperthyroidism and the hypothyroidism. So what is the causes of the hypothyroidism? So in the hypothyroidism, these hypothyroidisms can be divided into two groups. Okay, it can be divided into two groups, like the primary hypothyroidisms and the secondary hypothyroidisms. Okay, in the two groups, you can divide the two groups, primary and the secondary hypothyroidisms. So primary means the causes related to the thyroid glands, defects in the thyroid glands. Then it is a primary hypothyroidism. Secondary means it is not related to thyroid glands, but others like the pituitary or hypothalamic. There is some defects or damage in the pituitary or the hypothalamic regions, not in the thyroid, and that is known as the secondary hypothyroidism. Okay, so you can discuss one by one what are the causes for the primary hypothyroidism. So loss of functional tissue, like you can say the chronic lymphocytic thyroiditis, or we can say the Hashimoto's disease. It is an autoimmune disorders. Okay, autoimmune disorders. So this our immune systems will damage the thyroid glands. There is damage to thyroid glands due to the this autoimmune antibodies which is produced in this Hashimoto's disease, which is a autoimmune disorders. Okay. Similarly, the second cause you can say the radiation injury to the neck. If they are suffering from some of the cancer, so they will give the radiation therapy, and that causes the injury to the neck. Similarly, like the neck surgery, post-operative hypothyroidism. Thyroid gland dysgenesis, that is the developmental defects which you can see in the neonates. Dysgenesis means there is an abnormal organ development during the embryonic growth and the developments. Okay, that is a development or growth defects in the organs. So in the thyroid glands there is a developmental defects during the neonates on the embryonic conditions. You can see the second one, like infiltrative disease of the thyroid glands, that may be due to the some of the viral infections and the bacterial infections. So there is a few viral infections which causes the infiltrative disease of the thyroid glands. For example, you can see the MCOMS influenza virus and other respiratory viruses. Okay, MCOMS influenza and other respiratory viruses. There is some viral and virus which causes viral infections and lead to the infiltrative disease of the thyroid gland. Similarly, in the bacteria, you can see like the Klebsiella, Haemophilus influenza, Streptococcus viridans. So these are the few viruses which causes the hypothyroidism. Okay, these are bacterial infections caused by the influenza, Haemophilus influenza, Klebsiella, and Streptococcus viridans. Few example which causes the infiltrative disease of the thyroid glands and lead to the hypothyroidism. Other causes like defects in the thyroid hormone synthesis, which leads to the hypothyroidism, like you can say the congenital biosynthetic defects, endemic iodine deficiency, drug-induced defects that leads to the hypothyroidism, like lithium, glucocorticoids, iodine. So these are the few drugs which causes the defects in the thyroid hormone synthesis and leads to hypothyroidism. Idiopathic primary hypothyroidism, so defect in the TSH receptors. So the defect in the TSH receptors, so TSH will not able to bind to these receptors and it will not able to stimulate the synthesis of thyroid hormones, the synthesis of T3 and T4. As you have discussed in the previous class, I have shown the diagrams for how TSH will go and bind to these receptors and causes the activation of G proteins. And finally, there is a formation of the cyclic AMP and activation of the protein kinase A. So if there is a defect in the TSH receptors, so that leads to the defects in the thyroid hormone synthesis. And finally, you will have the hypothyroidism. So anti-thyroid agents, like for example, you can say propyl thiouracils. So anti-thyroid agents that defects the thyroid hormone synthesis by affecting the, we can see the oxidations. So this iodide which converted to the iodine, this process will be defective by these anti-thyroid agents. And second one, in the coupling of the DIT and MIT, this process will be also hampered by the antithyroid agents. Another cause like autoantibodies, which is produced against thyroiditis. So against the thyroid glands, there is a production of autoimmune antibodies, which decreases synthesis of these thyroid hormones, and finally you will have the hypothyroidism. Okay, so all this causes the defects in the thyroid hormone synthesis, like the congenital. If there is a deficiency of the iodine, like in the mountain regions or even the Himalayan regions, the level of iodine will be decreased. Okay, so iodine deficiency, you can see that people in the Himalayan people, the level of iodine will be less. Okay, that also lead to the hypothyroidism. So drug induced, some of the drugs also affects the thyroid hormone synthesis. Receptors defects, TSH receptor defects. Uh, so there is a receptor defect, so TSH is not able to bind to the receptors and the synthesis of thyroid hormones is not stimulated. Antithyroid agents like propyl thiouracils that hampers the oxidation of iodide to the iodine and also the process of coupling of DIT and MI2 to form the T3 and the T4. And autoantibodies, which is produced against the thyroid glands and hampers the thyroid hormone synthesis. So that all was the causes for the primary hypothyroidism. Now come to the secondary hypothyroidism, which is related to the uh, other than the thyroid glands. So you can see here the pituitary disease, hypothalamic diseases. So TSH deficiency, you can see in the pituitary diseases, and the hypothalamic diseases, you have the TRH deficiency, and that leads to the secondary hypothyroidism. So peripheral resistant to the thyroid hormones, you can see. So this is all regarding the cause for the hypothyroidisms, primary hypothyroidisms, and the secondary hypothyroidism. So you can see here the clinical effects of the hypothyroidism in the different organs. So you can see a start from the liver. In the left side you can see liver, increase in the cholesterol, LDL cholesterol and the triacylglycerols. In the intestine you can see there is a constipation and decrease the GI motility. In the reproductive systems, decrease the fertility, and in the menstrual cycle abnormalities you can see in the case of female. Okay, menstrual abnormalities. In the right hand side you can see in the brain, the patient may suffer from depressions, decrease the concentrations, general lack of the interest, impair fetal development. Okay, intellectuals and the development that will also impair in the case of the infant. In the heart, you can see decrease the heart rate, increase the blood pressures, cardiac output, and diastolic dysfunctions. In the case of heart, you can say. In the kidney, decrease the kidney functions and fluid retentions, and you'll have the edema. Okay, so these are the few clinical effects of the hypothyroidism in the different organ. So what is the sign and symptoms you can see in the case of hypothyroidism, and you can easily identify the patient is suffering from the hypothyroidism. So the patient may show you they'll say the complaint of the fatigue, increase the sensitivity to the cold. In the case of hypothyroidism, the patient will give you the history of sensitivity to the cold, increase the sensitivity to the cold, weight gain, dry skin, constipations, puffy face you can see, and muscle weakness, impaired memory, and the depressions. So out of all this sign and symptoms which you will observe in the case of hypothyroidism, the more noticeable one is like weight gain, okay, and increase the sensitivity to the cold, okay. Then you can observe the dry skin and complain of the constipations. These are the few which is you can notice, and fatigue. Patient will give the complaint of all this, and you can observe in the patients which is suffering from the hypothyroidism. So you can observe for the fatigue. You can get the history of the increased the sensitivity to the cold, weight gain, dry skin, and constipations, and the puffy face, which you can see in the case of patients suffering from hypothyroidism. So you have to observe for all this. Okay, weight gain and increased sensitivity to the cold. These two, the patient is having these two, okay, with the associated other factors. So you can suggest them go for the thyroid function test because they'll be suffering from the thyroid disorder that is known as the hypothyroidism. Weight gain and increased sensitivity to the cold. These two, that is measured. Patient will complain of these two mainly, who is suffering from the thyroid disorder known as the hypothyroidism. So this is all about the hypothyroidism, the causes and the clinical effects on the different organs, and the signs and symptoms. So like fatigue, increase sensitivity to cold, weight gain, dry skin, constipations, puffy face, muscle weakness, depression, impaired memory. So all this complaint will get from the patients who is suffering from the hypothyroidism. Now come to the another disorder that is known as hyperthyroidism. This is a condition which occurs when the thyroid glands makes it too much of T3 and the T4 or the both. Okay, the level of thyroid hormones will increase. The level of T3 and the T4 will increase. So the causes for the hypothyroidism, the common causes are, you can say here, Graves' disease. That is also the known as the diffuse toxic hyperplasia. This Graves' disease are the autoimmune diseases which causes the hyperactivation of thyroid glands and which produces the more amount of thyroid hormones. Similarly, on the Plummer disease, that is also known as the toxic multinodular goiter. So in this condition also there is hyperactivity of the thyroid glands, and which produces the more thyroid hormones, and the toxic solitary adenoma. So the cancer of this thyroid gland that also lead to the increase in the level of thyroid hormones and causes the hyperthyroidism. So less common causes of the thyroid hyperfunctions. So you can see in the like the bacterial or the viral etiology. So it can form the acute or subacute thyroiditis. So less common acute or subacute thyroiditis that might be due to the viral or bacterial etiology. So Hashimoto's thyroiditis. So it is a autoimmune disorders. Similarly, you can see the lymphocytic thyroiditis, which is a painless subacute thyroiditis. And here you can see like TSS secreting pituitary tumors, thyroid carcinoma, postpartum thyroiditis, SCG secreting thyroid trophoblastic tumors, iodine-induced hyperthyroidism, T3 toxicosis, drug-induced thyrotoxicosis. So these are the few causes for the hyperthyroidism. Okay. So these are the causes for the hyperthyroidism. This is also divided into two groups, like primary and the secondary hyperthyroidism. The clinical effects on the different organ due to this hyperthyroidism, you can see here. On the liver, there is increased the lipid degradations, negative protein balance, and hepatic dysfunction you can observe. So on the liver, you can see the lipid degradation will be increased. Patient will have the negative protein balance and hepatic dysfunctions. On the intestine, there is a loose stool, increase the motility and the malabsorptions, increase the GI motility, and the patient will suffer from the malabsorptions. In the case of reproductive systems, you can see the fertility. Here also you can have the menstrual abnormality and the pregnancy loss. In the brain, you can see increase the adrenergic tone, excitability, and hyperkinesia. On the heart, you can observe the increase the heart rate, palpitation, increase the cardiac output, and the diastolic dysfunction you can notice. In the heart, the patient suffering from the hyperthyroidism. Similarly, in the kidney, increase the GFR and increase the renal blood flow. So these things you can notice in the kidney. Okay. So these are the effects of the hyperthyroidism in the different organ. And what are the signs and symptoms so that you can observe in the patients suffering from the hyperthyroidism? So we'll have the weight loss. Okay, weight loss, increase in the blood pressures. There is a sweating will be more in the case of hyperthyroidism. Develop the low tolerance to the heat. The patient will develop the low tolerance to the heat. Weakness, irregular menstrual cycles that you can observe, hair loss, and difficulty in the sleeping. So there are the few signs and symptoms which is related to the hyperthyroidism. So patient which complain for all this, like the weight loss, develop the low tolerance for the heat, like they'll say, I'm not able to tolerate the heat. Okay, the sweating, the patient will complain of the sweating, I'm sweating more. Okay, weakness, hair loss, and difficulty in sleeping. So you can suspect the patient is suffering from the hyperthyroidism. So which is very common nowadays. It's very common. This thyroid disorder is very common in the general population nowadays. Either it will be having the hypothyroidism or the hypothyroidism. So the anybody which is come to you with all these signs and symptoms, so you can suggest for the thyroid function test to test for the T3, T4, and the TSH at least. If they are not going for the anti-TPO, at least these three parameters they can check: T3, T4, and the TSH. Okay. If you will find out weight loss, more sweating, low tolerance to the heat, weakness, hair loss, and the difficulty in the sleeping, and you can suggest them for the thyroid function test. And It is 100% if you are observing all these signs and symptoms, they will have the hyperthyroidism. Similarly, in the case of hypothyroidism, what we have noticed, weight gain. Okay, weight gain. That was a main symptoms. Second one, you have increase the sensitivity to the cold. Even there is no cold in the environment, but the patient who is suffering from the hypothyroidism, they will feel the more cold. More cold they will feel. Even though other people they might not feel the cold, but the patient who is suffering from the hypothyroidism, decrease in the thyroid function, so they will feel the more cold. Okay, so that is the typical sign and symptoms of the hypothyroidism, that is sensitivity to the cold and the weight gain. Similarly, in the case of hyperthyroidism, weight loss and low tolerance to the heat. Like other people, they might not feel the more heat in the normal environment. Okay, but the patient who is having the hypothyroidism, even in the little bit heat, that is a medium heat for the other people, they will feel the more heat. Okay, more heat. They'll have the sweating. Even the other people, they'll be not sweating, but the patient suffering from the hyperthyroidism, that person will be sweating. Okay, and the hair loss also, in the which you can observe in the case of the male, hair loss. So that might be due to the hypothyroidism. So you can suggest the patient who is suffering from hypothyroidism and having all these signs and symptoms will come to you having all this problem, because now you are going to be doctor, so your neighbor, they'll come and say, I'm having this problems. So that time you can't say that I don't know. Okay, you can suggest them go for this. You might have the thyroid disorder, so you can test for the thyroid function. You can test for the free T3, free T4 and the TSH. Okay, so this is all about the thyroid disorders and the thyroid function test. So in the thyroid function test, I have last time I have included what are the different methods which is used to uh, quantify the thyroid function test, like the FT3, FT4 and the TSH. What are the different methods? Generally, they will ask in their practical examinations. In the sporters, they will give the some case which is related to the thyroid disorders. And the one question might be, what is the method for the estimation of the thyroid function test? Okay, so it is ELISA. Okay, enzyme linked immunosorbent assay, ELISA you can do. You can do the KILIA. Okay, KILIA, this is a chemiluminescent immunoassay. There is nowadays there is one more technique that is known as the e-KILIA. Okay, this is a version of the KILIA only. Okay, but this is known as the e-KILIA. Okay, in the starting, for the estimation of this thyroid function, they are doing the radio immunoassay, that is known as the RIA, radio immunoassay. Okay, but due to this disadvantage of this radio immunoassay, that is replaced, because this is a radio level, so patient will have the person who is estimating the thyroid functions, they might have the cancer due to these radiations. They have the exposure to the radiations, because the reagents for the thyroid function test, they will contain the radiation, because it is a radio immunoassay. So nowadays it is replaced, and for this technique you have to take the permission from the government. This RIA, that is RIA, radio immunoassay, you cannot perform as such. For that methods to be used, you have to get the permission from the government. Okay, so that is replaced by the ELISA, KILIA. These are the more preferred methods, and there is no radiation exposures because it contains the enzymes. This is enzyme linked. Okay, enzyme is linked, so it can convert the substrate into the product and it forms the color. Therefore, this is very safe. Okay, and less time consuming compared to the radioimmunoassay. So the most preferred method that is nowadays used in most of the laboratory, In the small lab also you can use, that is a ELISA. Okay, it is a cost effective also you can. And the little bit advanced laboratory, they are using the Kilia. Okay, Kilia, and the e-Kilia used by the some advanced laboratory. Even in the our setup in the Manipal Teaching Hospital, we are using the Kilia, chemiluminescent immunoassay, that is used, and the time for the estimation is also less. Like within half an hour you can get the reports, but by the ELISA it would take 1 hour 30 minutes. That is the minimum time which will take. It will take the 1 hour 30 minutes by the ELISA, but technique in the methods, the time which takes is very less. That is a half an hour. Some of the like the Kilia you can get in the 20 minutes. In the 20 minutes you can get the reports of thyroid function test. Okay, in the 20 minutes. So in the same day you can get the reports and you can get the advice from your physicians. Okay, and you can send them. So in the methods, so don't like the BMR and all that. The some of the exporters you have mentioned, not the all of you, but few of you have mentioned that BMR for the measurement of the thyroid function test. So you are not asking for the thyroid function test, the different what you are using. The method means you have to mention the method for the FT3, FT4 and the TSH. That is ELISA, Kilia, and you can write the radioimmunoassay, that is a RIA. So these are the methods, not the BMR. Okay, this is the one type to know the metabolic changes by due to these thyroid hormones, so that you can measure, but not is a method for the estimation of T3, T4 and the TSH. So that is a ELISA, Kilia and the radioimmunoassay, that is RIA. So these are the methods. So do you have any doubt? Any doubt you have regarding the thyroid disorders and thyroid function test? Yes or no? Are you there?
Yes, sir.
Really?
Yes, sir.
Okay. So any doubt?
No, sir.
That's a good one. No doubt, no confusion. So how many of you have joined? 76% have joined. Okay. So you can, I will upload these slides in the PDF format, so you can go through that. And when you go through the different books, what you have, if you don't have the books in your home, you can download from the Biochemistry, which is uploaded in the Biochemistry 2018. In that channel, you can go to the file, and in the file there is a ebook, and from there you can download the what books you want. Like all the basic book we have uploaded there, so you can download from that and go through that. Even I think Basudevan, Satyanarayanan, Harper, Lippincott. So all of this basic book we have added there. Even the practical book is also uploaded. So if you don't have book, you can download it and you can go through that. So it is in the Biochemistry 2018 batch. So in that you can go and find out. And I will upload in that section itself, the today class. So tomorrow we'll be discussing regarding the calcium homeostasis. So the last class you have left, so we'll discuss in that. Okay.